Assalamualaikum and good morning. I'm Hanan reporting live for the Hanan News Network. Today, we peel back the headline on a crisis that affects women globally and right here in Malaysia, cervical cancer. Our main story today, cervical cancer cases linked to viral suspect HPV 16 and 18 under investigations. We are following a persistent silent invader. The main headline of the day is clear. Silent invader, sexual contacts open door. This is not a story of sudden onset. It is a years-long investigation into how a common virus can lead to deadly consequences. We will uncover the entire sequence of events from initial transmission to the devastating outcome, and most importantly, what the public can do to protect themselves. Stay with us as we dive deep into the medical report. First, the essential background. The disease under review is cervical cancer. In simple terms, this is a disease where the cells in the cervix, the lower part of the uterus, begins to grow out of control. Crucially, it is by far the most common HPV-related disease, meaning our viral suspect is directly linked to the crisis. Now, let's look at the local impact. The Hanan News Network has reviewed the latest figures from the Cervical Cancer Elimination Action Plan 2021 until 2030, and the numbers demand attention. Our headline here reads, HPV cases rising in Malaysia. In the past 5 years alone, over 10,500 women in Malaysia have tested positive for the human papillomavirus. While we commend the efforts to screen over 160,000 women nationwide, these rising case numbers underscore the urgent need for awareness and preventative action. This is a public health story that cannot be ignored. Our investigation continues into the causes and transmissions of this disease. The primary causes, as established, is the persistent infection with the human papillomavirus or HPV. We have identified 14 high-risk HPV subtypes, but the primary offenders, the one frequently found at the scene of the crime, are HPV type 16 and 18. These two types commonly increase the risk of cervical cancer. The transmission route is direct and simple. Sexual activity. HPV can be contracted through any kind of sexual activity, including intercourse, oral sex, and anal sex. Now, let's follow the timeline of the silent invasion as outlined in our report. First, HPV enters through sexual contact. The virus gains entry to the body. Second, it infects cervical cancer. The virus settles into the tissue it targets. Third, persistent infection stays for years. This is the critical silent phase. The body fails to clear the virus and the infection becomes chronic. Fourth, the cell changes develop. Over time, the virus causes precancerous or abnormal changes in the cervical cell. And lastly, untreated lesion may progress to cancer. If these precancerous cells are not detected and treated, they can eventually lead to invasive cervical cancer. This progression emphasizes one key point. Time is the enemy. Years of silence lead to the eventual emergence of the disease. For our viewers, recognizing the sign is the first line of defense. We are issuing a public health warning detailing the symptoms and clinical features of cervical cancer. These are the red flags we must watch for. First, vaginal bleeding. This is non-menstrual bleeding, bleeding after sex, between periods, or after menopause. Any unusual bleeding is a front page alarm bell. Second, unusual vaginal discharge. Discharge that is unusual in color or has a foul smell. Third, pain during sex. Dyspareunia. This is a noticeable symptom that should prompt immediate medical attention. Fourth, pelvic or lower back pain. Persistent pain that cannot be explained otherwise. Last, menstrual changes. Menstrual bleeding that is longer or heavier than usual. If any of these features appear, the time for investigation is now. Our analysts have compiled the list of factors that significantly increase a woman's susceptibility to this viral culprit. Our editorial review details the primary risk factor. First, sexual activity. As our headline stated, sexual activity is the transmission route. Being sexually active, particularly having multiple partners, increases the likelihood of HPV exposure and infection. Second, smoking. This is often overlooked. Exposure to many cancer-causing chemicals in smoke affect organs beyond the lung, including the cervix, making cells more vulnerable to HPV effect. Third, family history. Finally, genetics may play a role. Chances are higher if your family has had cervical cancer, as researchers suspect they might be an inherited condition that reduces the body ability to fights off HPV. And now for the positive headline, we have the tools to fight back. Our reports on control and prevention strategies provide two powerful solutions. First, HPV vaccination. This preventative measure has the potential to prevent more than 90% of cancer caused by HPV. The vaccine like Gardasil 9 and Cervarix stimulate the body immune system to develop antibodies against the virus. These are readily available here in Malaysia. Second, cervical cancer screening. These involve HPV tests and pap smears. These tests are vital because they find high-risk HPV infections and, crucially, abnormal cell changes that can be treated before they turn into cancer. Screening is generally recommended to begin in a woman in 20s. Detection is cure and screening is the tool for detections. That concludes our special report behind cervical cancer. We have provided the essential information from the silent invasion and the development timeline to the risk factor and the powerful strategy for control and prevention. The data and facts presented today are grounded in research from respected sources, including the Cancer Council and Cancer Research UK. Thank you for tuning into the Hanan News Network. We hope these reports empowers you and those you care about to take preventative actions. I am Noralya Hanan signing off. I will now take any question you have regarding today's investigation. Thank you.